As a future nurse, you will encounter many medications. Heparin is one of these medications. It is an important medication that you need to understand. Heparin is a powerful anticoagulant. This means it prevents blood clots. Nurses need to understand heparin. You will need to know how to give it safely. You will also need to teach your patients about it. Heparin is often used in hospitals. It treats and prevents deep vein thrombosis, or DVT. It can also treat pulmonary embolism, or PE. These are serious conditions. They can be life-threatening. Understanding heparin is key to passing the NCLEX. It is also key to being a safe and effective nurse. Heparin can be confusing. There are different types. There are also different ways to give it. It is important to understand these differences. This will help you answer NCLEX questions correctly. It will also help you keep your patients safe. This essay will guide you through the essentials of heparin administration. Knowing how to calculate dosages is important. You also need to know the different administration methods. You will learn about monitoring for safety. We will cover patient education. By the end, you'll be more confident in your heparin knowledge. You will be ready to succeed on the NCLEX. There are two main types of heparin. These are unfractionated heparin, or UFH, and low molecular weight heparin, or LMWH. UFH is given intravenously, or IV, or subcutaneously, or SC. LMWH is given subcutaneously, or SC. Each type of heparin has a different way of working. UFH works quickly. It acts on clotting factors in the blood. It prevents clots from forming. LMWH works more slowly. It acts on specific clotting factors. The type of heparin used depends on the patient's condition. It also depends on the doctor's preference. You need to be familiar with both UFH and LMWH. You'll need to know how to administer them safely. Knowing how to give each type of heparin is important. IV heparin is given through a vein. It can be given as a continuous infusion or as a bolus. SC heparin is given as an injection. It is injected into the fat layer under the skin. Dosage calculations are a key part of heparin administration. You need to be able to calculate dosages accurately. Incorrect dosages can have serious consequences. For UFH, you'll often need to calculate bolus doses. You will also calculate infusion rates. This involves using the patient's weight and the heparin concentration. For LMWH, dosages are often standardized. You will use pre-filled syringes. However, you still need to double-check the dose. Make sure it is appropriate for your patient. Safety is paramount when administering heparin. Always double-check your calculations. Verify the dosage with another nurse. Follow your institution's protocols carefully. Heparin has a narrow therapeutic index. This means the effective dose and the toxic dose are close. Even small errors can have big consequences. Monitor your patients closely for adverse effects. Bleeding is a common side effect of heparin. Watch for signs of bleeding. Look for blood in the urine or stool. Look for bruising or bleeding gums. Be aware of less obvious signs. Look for changes in mental status or level of consciousness. Report any signs of bleeding to the doctor immediately. Patient education is a critical aspect of nursing care. This is especially true with a medication like heparin. Patients need to understand their medication. They need to know why they are taking it. Explain the purpose of heparin to your patients in simple terms. Tell them it helps prevent blood clots. This will help them understand its importance. Inform patients about potential side effects. Explain the signs of bleeding. Let them know when to seek medical attention. Empower your patients to be active participants in their care. To succeed on the NCLEX, practice answering heparin-related questions. Use practice questions and clinical scenarios. Focus on key concepts. Know the different types of heparin. Understand administration techniques. Be confident in calculating dosages. Prioritize patient safety. Remember to educate your patients. Mastering heparin administration takes time and dedication. By understanding the types of heparin, dosage calculations, administration methods, safety measures, and patient education points, you'll be well prepared for your NCLEX exam and for providing excellent nursing care. Keep practicing, and you'll be well on your way to NCLEX success.